All right, good morning, good morning, good morning, good morning. How we doing? It's morning somewhere, right? See, right? Like to thank everyone for coming out, sharing this day with us. This is our first formal, right, where we are gathering people and talking about what we do here at 1743 Fulton Avenue, the home base of Phipps Neighborhood Public Health Corps. My name is Willie Thomas. I'm the Director of Community and Public Safety for Phipps Neighborhood, right? And the Public Health Corps is something very dear to me, right? We have a tremendous team of incredible messengers, right? Who I'm going to talk a little bit about later on, and you will see the results of their incredible, life-saving work here in the Bronx. Right? So I'm gonna start with talking a little bit about the vision and mission of Phipps Neighborhoods. You could read along with me, but the vision of Phipps Neighborhood is a vision where we, as an agency, as an organization, that's 267 staff strong, primarily in the Bronx, envision a New York City where community members of all ages have meaningful opportunity to realize their potential, build skills, and strengthen their neighborhoods. Right? No one exists without a vision. Right? No one exists. We have to see where we're going. We have to see what we want that to look like. Right? And for Phipps, that is our vision, and it's tied right into our mission, right? Where we work constantly and consistently to create safe, inclusive spaces where community members have access to education, career, and economic opportunities to succeed at school and work, raise healthy families, and build thriving communities. Thriving, healthy communities. That's the mission of Phipps Neighborhood. Right? We adopted that maybe about 2.5 years ago. But even from the inception, and Phipps Neighborhood is about 52 years old now, and counting. Right? Today's agenda, right? So we're going to talk a little bit about what brought us to this work, right? And that was the COVID-19 disparity grant, right, that was funded by New York City Department of Health and Mental Health. And I am so glad, so pleased, and feel special that we have representatives from New York City Department of Health here joining us today, along with the rest of our partners. Yes, let's clap it up for them. Right? And we will introduce them a little bit more, right? And we're going to ask them to stand up a little later on. And we're going to talk about our new focus, right? And I want to say this. COVID is not over with. COVID is still with us, and it's going to be with us for the rest of our duration, just like the flu, unfortunately, just like the common cold. Right? And so it's always going to be critical for us to protect ourselves. But we pivot along. You have to know, we have pivoted somewhat into a new focus area because COVID taught us a lot. It taught us a lot about what is taking place in our communities, with families not having insurance, families not connecting with primary care. And so we are pivoting to a new area where we're doing a lot more referrals, right? And connecting people to healthcare providers. And then one of our dedicated team members is going to do a little motion exercise. You ain't gonna have to get up, you ain't gonna have to kick your legs, right? Or anything, but we're gonna get that blood flowing this morning. So let's move on. Because I was told, right? It's all right for me to be strong, but I bet not be long. Right? So I want to talk a little bit about COVID-19 disparity grant. When we first started this initiative about 3 years ago, and I'm so thankful to my executive director, Ms. Rosemary Adonis, many of y'all know, who came to me 4 years ago just about, and like, right, I had just lost my sister as a result of COVID, and she like, Willie, we're thinking about pursuing this opportunity, and right, we would like for you to oversee it, right? And I'm like, come on, bring it. And they brought it, right? We had some goals, right? All across the Bronx, people were being hospitalized, and we were seeing a high rate of fatality as a result of COVID-19. It hit our community like nothing else. And right, we wanted to put some effort and energy into reducing that. And so we started out, let me go back. We started out having 3 or 4 main goals, right? Reduce the number of fatalities. People, right, succumbing to COVID-19. Increase, right, the number of people being vaccinated in our communities, right? In our communities, the vaccination rate was very low. And so more and more people were getting sick, more and more people were being hospitalized, and more people were dying. And we want to, of course, reduce the number of fatalities. Those was, right, the goals that was presented to us by our funders. And then there was, right, to do that work, right, we had to come up with some community-based solutions. Because there was a whole lot of misinformation out there. And the only way we can do that is by connecting with the community and getting the community involved and helping us come up with solutions. Public health workforce infrastructure, right? Phipps Neighborhood, for the most part, we did not have a workforce. We had to put one in place. So we had to build that infrastructure, right? We had to build relationships. Relationships is partnerships, and they are invaluable when we're doing the type of work we're doing, right? Collect data, right? We did listening sessions, educational sessions, right? We heard from the voices of the people that was most impacted and affected by COVID, right? And then we had to establish our reporting practices, right? And our reporting practices was not just for our funders, but was also to the community that was shared during educational sessions, and it went on to elected officials. And nobody can tell me that my team of credible messengers wasn't doing work, right? They wasn't doing the work. Of course, they was working. They was working, right? During the course, and I thank again our public, our New York City Department of Health officials who helped, right, bring these numbers to realization. Right? The public health in the 2.5 years that they did this work under that funding, 662 in-person outreach events, right? Dedicated staff that went out to do outreach at events, 662, right? They spent 1,788 hours of street level outreach out in the community, connecting with community residents. In doing so, 25,464 people were screened for referrals. 25,464 people screened for referrals. Out of that, right, we made 27,444 referrals, right? Because some people, when you look at the different, some people we refer to more than one thing. And 6,792 COVID-related referrals, right? That was life-saving work. And again, it couldn't have been done without everyone in this room, the community, right? Some existing partners and some new partners. And we're gonna hear a little bit from our partners, but I want to thank our funders, the New York City Department of Health. Alfie and Corinne, can y'all please stand, right? They deserve to be recognized, right? Not just for their work here in the Bronx, but throughout New York City. Right? It was a relationship that we cherish, and we look forward, to staying connected with them, relying on them, as everyone in this room should. Thank y'all. Now, without any further ado, I'd like to introduce, to some and welcome, Miss Aurelia, who is the director of the Public Health Corps.
Thank you so much. Before we begin, I'm just gonna check on chat, make sure everything's okay. Awesome. Y'all can still hear us on Zoom?
Yes.
Awesome, great, okay. So before I begin, my name is Aurelia Cineret. I'm the Program Director of Public Health. Me llamo Aurelia Cineret. My Spanish is not amazing, but please bear with me. And before I get into the program that we'll be doing moving forward, I want to set the stage for why we're doing what we do here in public health. Okay, so in New York City alone, we have about 13% of adults that do not have health insurance. And when we look at New York City with needed medical care, about 13% of adults do not have the needed medical care that they need. So that's like going to their primary care physician, going to the health services that they need to be going to. Now, when we look at Bronx specifically, so those numbers were just for all of the 5 boroughs. When we're looking at Bronx, that number jumps up to 17%. En el Bronx, el 17% de las personas no tienen seguro médico. When we're looking at adults without needed medical care, that jumps up to 15%. En el Bronx, el 15% de las personas no cuentan con la atención médica necesaria. Now, when we're looking at Morrisania and Crotona alone, so this neighborhood that we're living in right now, that jumps up to 23%. So 1 in 4 adults in this neighborhood do not have health insurance. En Morrisania y Crotona, 1 de cada 4 personas no tiene seguro médico. And then when we're looking at adults without needed medical care, that jumps up to 20%. So 1 in 5 individuals in this neighborhood do not have the needed medical care. En Morrisania y Crotona, 1 de cada 5 personas no tiene la atención médica necesaria. Now, when we talk about avoidable hospitalizations, that's hospitalizations that could be avoided if you actually went to your primary care doctor and saw the services that you needed to see. So when we're looking at New York City alone, 1,200 people per 100,000 adults could avoid hospitalizations if they went to their primary care doctor on an annual basis. And when we're looking at Bronx specifically, that jumps up to 2,000 people per 100,000 adults. En el Bronx, unos 2,000 de 100,000 personas pueden evitar la hospitalización. Now, again, when we're looking back in Morrisania and Crotona, that jumps up to almost 3,000 adults per 100,000 adults that can avoid hospitalizations if they go and see their primary care doctor. En Morrisania y Crotona, casi 3,000 de 100,000 personas pueden evitar la hospitalización. So I'm giving you all of these statistics, but what's the point of me sharing this with you? So we are the program of public health. We have our community health workers. I want to give you a raise, give them a high, and I just want to emphasize that this is the work that we're doing. We want to connect you to the healthcare services and insurances that you need to have the best health you can, prevent future diseases, and promote healthy lifestyles. So we have 3 goals of this referral program that we want to chat about. The first one is providing health and social service referrals to community members. So I know a lot of you guys know the community health workers. They're your trusted people that you see on a daily basis. And so we want to be those people that you come to if you need any health services or any questions about insurances. We're also going to be conducting weekly health education sessions. So that'll be here, that might be at a different site, but please look out for us when we do have some events coming up. And I'll share a bit more of the next couple of weeks of events. And we have some flyers in the back for events as well. And then lastly, we're hosting monthly external coalition meetings, and that's more for our partners to just kind of chat and hear a bit about what they're seeing in the community that is being brought up regarding health issues, and hear from you guys and bring it back to their health services. So I'm going to transition over to our partners. So we have a couple partners here today, both on Zoom as well as in person, that will be sharing a bit of information. But I'm going to have our staff to introduce themselves and introduce the partners. So first off, we have Charisse.
Good afternoon, everyone. My name is Charisse Cash, and I am a community health worker. I would also like to introduce Ellen from Allegra Health Services. She will be on Zoom. And Adonia, which is here right now to answer any questions for you.
Hi, good afternoon. This is Ellen Sharaga. I'm happy to be here today on Zoom. We have a medical center at 3475 3rd Avenue and across street of East 167th and 168th Street in your neighborhood. We have the following services for you and your families. We provide primary care, which is internal medicine for adults and pediatrics. We take care of all of your cholesterol, your cardiac, your diabetic needs, immunizations, medication management. We have a pharmacy on site as well. And we're here to do all of your annual physicals and make sure that you are keeping up your health and wellness. Next slide, please. We have women's health, which is very, very important and an unmet need in our community. It focuses on birth control, breast exams. We happen to have a very high breast cancer rate in this community and really want to make sure that we get ahead of it, as well as cervical cancer. Our women's health provider does cervical cancer screenings through Pap smears on an annual basis, is also there to provide prenatal care, postnatal care, be on top of HIV and HPV testing, and making sure that from a sexual health perspective, everybody is educated and providing information for safe sex, STI testing, and really being there as a women's health provider for our women in the community. We know that women are the matriarch of their families. They're taking care of their families, but if they're not taking care of themselves, we can't be here for our husbands, our children, and our parents. So very important from a women's health provider perspective. Next slide, please. We recently opened up our dental suite. We have a dentist from the community who comes to our office 2 days a week right now. We do pediatric and adult dentistry. It is another unmet need in our zip code. We're there to do all of the routine general dentistry, like cleanings and x-rays and all preventative care to make sure that you protect your teeth and your mouth moving forward. We are only given one set, and it's something that we need to take care of. We also can take care of first-line oral surgery. And if it's more invasive, we will refer out to the St. Barnabas dental program. They're our partner in the dental suite as well. If there's any questions, I know that we're on a tight time schedule, but we have Adanya there on site at this meeting today. He'll be available for questions, additional information, and we also have our flyers on site. Thank you.
Hello, good afternoon, everyone. For those that don't know me, I'm Javier. I'm a community health worker here at Phipps. And I'm so happy to introduce our next presenter, who's Elizabeth Bravo Santiago, that's coming to you from Caring Kind via Zoom.
Hello, Javier. Can you hear me?
I can hear you, yes.
Oh, okay. Great. So my name is Elizabeth Bravo Santiago, Director of the Medical Alert New York City Wanderer Safety Program at Caring Kind. Caring Kind is located at 360 Lexington Avenue in Manhattan. We're on the 3rd floor, and we have a helpline as 646-744-2900. We also have a website as www.cknyc.org. So who do we serve? While we wait for a cure, the best thing we can do is to be caring and kind to those impacted by the disease. We do this through a host of programs and service and educational opportunities. For whom? For people with Alzheimer's or any form of dementia. For family members and partners, friends providing care or support. For care staff, healthcare workers, dementia service professionals, and the community, the residential communities, the culture organizations, and anyone needing any kind of training in this area. So who is Caring Kind? What is our history? Our history is the following. In 1978, we were founded as Alzheimer's Society, one of the nation's first charities focused on dementia. In 1985, we were founded the New York City chapter of the Alzheimer's Association. In 2015, we retained independent charity status as Caring Kind when Alzheimer's Association became centralized. And our mission is very important to us: to create, to deliver, and promote comprehensive and compassionate care and support services for individuals and families affected by Alzheimer's disease and related dementias, and to eliminate Alzheimer's disease through the advancement of research. And we achieve our mission by providing programs and services for individuals with dementia, their family and professional caregivers, increasing public awareness, collaborating with research centers, and informing public policy through advocacy. So what do we offer? We offer one-to-one sessions. We offer small group programs. We offer education seminars and webinars. We offer trainings. We offer special events. And how do we do this? We do this via virtual and in person. And most important, our services that we provide are free of charge, and they are available in English, Spanish, and Chinese. So, family, partners, friends, caregiver services that we offer. Caregivers who are family and or partners, friends, we offer the following services. We offer the helpline. If there's anything you take away with you this afternoon, please jot down our helpline, 646-744-2900. There, you could get information, referral, resources, and dementia consultations. We offer the Medical Alert Wanderer Safety Program. We offer support group to spouses and partners and adult children. We offer Partnering Together support workshop for new and or families and members and friends. And we offer one-to-one coaching services, and that's led by social workers at Caring Kind. We also have engagement programs. It's very important to maintain a level of activity in your day-to-day life. And so we offer engagement programs like Connect to Culture or Connect to Baseball. And so we have expanded our engagement programs for individuals and caregivers and families. And our Connect to Culture programs features cultural opportunities around the 5 boroughs where various cultural institutions such as art, we offer dance, music, science and history, and natural history. So you could find more about our engagement program on our website or by calling the helpline. For caregivers, it's very important to maintain connection with people who could understand what you're going through. And so we provide the helpline, and this is a trusted source for information. The referrals, the resources, and dementia consultations are very important. We offer support groups, over 80 support groups, and we professionally train and supported facilitators to do these support groups. And the groups that we provide are for spouses, for partners, for adult children, young onset, people with young onset, or the LGBTQ plus community. And we also offer a bereavement group. Okay. We offer the Medical Alert New York City Wanderers Safety Program. And so that is a 24-hour nationwide emergency response service, which provides assistance for finding persons diagnosed with Alzheimer's disease or related dementia who wander locally or far from home or have a medical emergency. We offer bracelets are available for the person living with dementia that live in the 5 boroughs of New York City. And we also offer an identification bracelet for the caregiver. Medical Alert does charge an annual fee. However, there are scholarships available for bracelets purchase at the first annual fee made possible through a generous grant from the city council members as well as other funders. Partnering together, that's adjusting to life as a partner of someone living with Alzheimer's or another form of dementia, is life-changing. And we have this workshop, and it is offered to family and friends, partners of people with Alzheimer's or any other form of dementia. This is a very small virtual group. It's typically 10 weeks, and it's about discussions. And so some of the things that may be discussed is, one, what is dementia? Telling your story. How has it changed relationships? The grief and loss, not only the grief and loss of someone of dying, but the grief and loss of the changes in the person. Stress and self-care. How do you do that? Getting help and care. We talk about legal and financial issues and end-of-life issues and why. So many people ask why. And so that is spoken about in this small virtual group. Like I said, it's usually a 10-week discussion group. We offer education workshops for family and supported friends. And this is workshops to better understand the dementia for the process of dementia. What is going to happen with the person that's been diagnosed? Partnering together for those new in caregiving. Caregiving can be very new to many people. How do I go about this? What do I do? My plan of action. We offer family caregiver workshops, caregiving through the middle stages where the personalities and behavior begin to change. We offer legal financial issues meetings, and we offer understanding Medicare home care meetings. And this is very important if you want some home care service. How do I navigate this? Well, you don't have to do it alone. Give us a call. And then we have regular monthly topical educational seminars. It can be bathing without a battle, or how to safety services. So and that you can find on our website. And then we have for family and friends, we have caregiving coaching. So this is a private one-to-one coaching meeting, and basically is to support and train caregivers and their loved ones about safety issues, using the social support managing stress, and how to really take care of yourself as a caregiver. Healthy living and understanding your feelings, because caregivers, your feelings will be going up and down yourself. And how to skillfully communicate with the person that's just been diagnosed with the disease, and relating memory problems to behaviors. So again, this is a 3 to 6 month session. It's done virtually or in person in English and Spanish. And all our programs are on our website on www.caringkindnyc.org, or you could call up the helpline at 646-744-2900. Thank you so much.
Hello, everyone. My name is Portia Wilson. I'm a CHW here, and today I'm going to present to introduce Amelia from SM Healthcare.
How are you? How's everybody doing today? Thank you.
Well, thank you.
Thank you for coming and joining us. My name is Emilia Tavares. I'm coming in representation with Gaudi as well, my colleague of SM Healthcare. We have multiple programs in SM Healthcare. I can take care of the presentation here, right? Okay, wonderful. I want to talk to you about primary care, specialty care, which are some of the services that we share in our new initiative, a new program that we created. It's called the SM Golden Health Program. Within the SM Golden Health Program, we basically connect the community over 65 or Medicare eligibles to the services that they need. The healthcare system is already complicated to navigate by itself. And what we're doing is trying to assist the community to navigate the system and help them connect them with the services that they need. SM Healthcare have over 35 locations within the Bronx, where we offer urgent care, primary care, and specialty care services. And we provide these services within an integrated and coordinated system, meaning if you go to a facility that is in Castle Hill, you can go to another facility in Riverdale, and we will have everything coordinated in the same internal system, okay? Also, besides the over 35 locations, we have over 35 primary care providers in all our locations combined. Within the SM Golden Health Program, which is the one that I explained to you before, we coordinate the services that the patients need. If you need medication, send-day medications with our program, you can schedule an appointment, which sometimes it becomes difficult, and that's what I've been hearing in the community, to schedule a primary care physician appointment within probably 2 days, within a week. They have to sometimes go to the emergency room first and then call the primary care to let them know that they are in emergency room. We try to avoid and reduce emergency room visits and hospitalization by providing higher quality services, connecting the patients to the services that they need. With the SM Golden Health Services, we also provide and assist with transition of care, post-acute monitoring, podiatry services at home, transportation benefits. If they don't have transportation, we have programs internally and coordination with services that we can find transportation available to bring them from their appointments to their house and to the house from their appointments as well. We connect them with organizations to provide them durable medical equipment, SNAP benefits, maximize their OTC benefits if they might need these services as well. With the household program that I would like to introduce the Gaudi, we serve all the 5 boroughs, including Westchester, Nassau, Suffolk County. If you happen to have the inconvenience not to get out in the community to see a provider, we facilitate a provider for you to come to see you in the house. We do EKG, we do flu shots, we do blood work.
We have podiatry services, as mentioned. Basically, everything that you can see inside of a doctor's office, we bring straight to the homebound patient. Now, I don't want to confuse homebound with someone who is not able to leave their home. This can refer to anyone who has any issues with their ADLs. And what that is specific to is assisted, assisted daily living functions. You know what I mean? So it's like, even though if you do go out, you are still able to have our services. And right now, I know it's spring, so we're all feeling nice, but soon the summer is going to be coming and it may be too hot for our seniors to leave the home. And as well, the same thing can happen during the winter. So we wanted to make sure that you're still receiving your services in your home, in their comfort, and everything is still up to date regarding, like I said, the EKGs, the mammograms, any type of potential screenings, as well as the care management. And I just wanted to touch on one little thing here that is regarding our TOC program, and that's regarding our transition of care. One of the main things that I heard from Aurelia's mention is the amount of emergency room visits. A majority of those emergency room visits come 1 month after you're being discharged from the hospital. Why? Because the patient doesn't have the proper durable medical equipment. The caregivers are not given the proper information, as well as, just basic things that can be avoided within that first month. So what Essen does is that we specialize in really paying attention to that client for the whole month that they left the hospital or that they left the nursing program, to eliminate those visits to the emergency room and eliminate any type of health problems that can complicate itself within the first month. And then after we take care of you for that whole month, we have you in our house call program with regular checkups. Because even though you are home, we also want you outside. So, I want to take this moment to thank you guys for listening to us and Essen's presentation. If anyone wants any additional information, or if you want to call, or if you feel like you do qualify for the program, please see me. I have this yellow clip book, and I'll take your name and number, and I'll make sure you get a call within 48 hours. That's a great question. A lot of people only offer in-home, over the phone visits. We do both. So we make sure that the doctor does come see you, or the nurse practitioner does come see you in the house. However, if you are busy and what you really need is, like, let's say you need a refill for medication, or you need a form like a NIA form for your home care provider, or a DOH form, we'll see you televisit wise, save you that time, and make sure that you get your medication as well as your forms on time. So to answer your question, we do both.
I would like to add as well that we accept all insurances. If you come with commercial insurance, if you come with Medicare, Medicaid, Medicaid only, Medicaid, any insurances that you have, currently you don't need to change your insurance to come to any of our facilities or to receive also our household program services as well. Thank you so much.
Any other questions, please come see us here at the end.
We will be here through the rest of the presentation if you have any other questions. Thank you so much.
Good afternoon, everyone. I'm Kendra. I'm the administrative assistant. And next up is Nikita from Fortuna Health, and she is with us via Zoom.
Thank you, Kendra. I'm just waiting to see if any slides pop up. Question. Perfect. It's so great to see some very familiar faces over Zoom. And we're very excited to be working with Phipps, and one of our other partners, Essen, is in the room, so it's nice to see everyone. Our goal with Fortuna is to support folks at Phipps and otherwise to be able to more easily navigate Medicaid. So about 1 in 4 New Yorkers qualify or are on Medicaid, and it allows them to receive $0 healthcare, which allows them to go and see providers like Phipps, Essen, for example. And we want to make it much simpler to go through the process of understanding, do you qualify for Medicaid? That can be very confusing and hard to understand. Getting easily through the enrollment process, and then being able to get onto Medicaid and do the renewal process. So specifically, we're working with Phipps on a renewal drive to help close that loop for folks that may have accidentally fallen off Medicaid during some of the last year of redetermination, which was very confusing for a lot of folks, and help them navigate re-enrolling and renewing their coverage. We're really excited to be able to provide this to Phipps, and the statistic earlier that Arali was sharing on the number of folks that are uninsured. We want to make sure that that gap closes so that they're able to, continue to receive care wherever that might be, as Essen and some of the other partners are sharing, whether it's in the home or being able to go to the clinic. It's incredibly important to be covered so that you're able to get that preventative care, that primary care. God forbid, something even worse happens, like going to the emergency room. You always want to make sure that you're covered. And if you qualify for Medicaid, you should be on it. So that's our goal with Fortuna, making it super simple that no matter your circumstance, no matter what language you speak, we're available in multiple languages, including Spanish, including Mandarin/Chinese. So being able to support and meet people where they're at. Awesome. That's it for me. Perfect. So we are going to be doing on April 11th that renewal drive. So to speak to one of the things I mentioned earlier, it's been very confusing around renewals in the past year in particular. So a lot of New Yorkers have lost coverage because they missed this notice in the mail that told them to renew. There were changing rules. Now folks who are undocumented over the age of 65, for example, qualify for Medicaid, and that's a new thing. So our goal is to, again, don't have to know any of the rules, just come in. We will, be able to support you through that renewal process, regardless of your, the circumstance. We make it very easy. It takes about 90 seconds to go through that process of connecting your account. So we do that on your behalf with the state of New York so that you don't have to worry about it. All of it will be handled by Fortuna. So we're very excited to do that online and in person with Aralia's team and up at 1743 Fulton.
Awesome. Thank you so much, Nikita. Thank you so much to all of our partners. Before we close out, I just want to share some upcoming events that we have that will be here. So on Thursday, so tomorrow from 4 to 6 p.m., as Nikita mentioned, we have Medicaid renewal support. So come on in. We'll probably also have some food as well, refreshments, light refreshments. So please come on in and check that out. Monday, April 22nd, 11 to 12 p.m. We'll also have an Earth Day Zumba event here. So hopefully if the weather is good, we'll have Zumba right outside here. On Saturday, May 11th, we have crochet and convos. So you can come in, bring some crochet or knitting supplies. We'll also have some as well. And we actually have a healthcare provider that will be coming in and she can answer questions about women's health, anything that you want to know. It's going to be like a conversation type of event. And then last but not least, we have Monday, May 13th from 4 to 5 p.m. Also here will be an Alzheimer's educational session led by Karen Kynes. So please mark your calendars. We have a couple flyers in the back for those as well. And lastly, thank you so much to our funder, Mother Cabrini, for funding this project till the end of the year. Hopefully longer, we'll see. And I'm going to leave it to Kendra to close us out. Thanks.
Thank you all for coming. If you have questions or if you're interested in a health referral, you can email us at publichealth@phippsnewyork.org or call us at 718-716-1196, which is our office number. If you guys can, there is a QR code here for our post-event survey. If you guys could complete that. If not, we do have a paper hard copy here if you want to just do it hard copy. So thank you again, guys, for coming. And that is it.
Thank you. Have a
Thank
nice
you.
day. Bye-bye.